Happy Messy Monday, guys. DCN here. I'm Brittany.
I'm Satasha.
We are Billing and Credentialing Network. Let's hop into it.
Let's do it.
We love us a good Medicare update, guys. We also love to call out chaos when we see it.
I know y'all ain't heard, so y'all pay attention. Pay attention. This
Please.
episode is needed.
Please. Today, we're talking about the Medicare rule changes that just went into effect yesterday, January 31st, 2026.
Today.
Today,
Actually,
yeah,
it's today. Actually, it's yesterday, the first.
yeah.
It ended on the 31st. It went
So
into
that was
effect yesterday on the first.
today, because today is Monday.
Unless you was working yesterday on the first.
Big changes for telehealth that could literally affect your billing and your access to care starting today. Let's get into it.
First and foremost, as we were saying, January 31st, 2026, the telehealth flexibility expired. Now, we did talk about this back in October. If you watch us, we talked about this back in October that things were going to change in 2026 because they were trying to lift some of those protocols that they had put in place for COVID. We got an extension in October. Y'all got lucky, but since the government shutdown, nobody was re-talking about it. Nobody's, and we have so much other things going on. Healthcare is not the number one priority for the Senate right now. The telehealth flexibilities did expire January the 30th of 2026. You've heard about the telehealth being expanded since COVID. Guess what? It expired. It expired.
With that being said, our suggestion would be if you have a new spanking brand new Medicare client scheduled for this coming week or upcoming down the road this month or whatever, most likely that first visit will need to be in person. We aren't sure how quickly the partial shutdown will last. It's unclear if Medicare will deny coverage of new client sessions if they are not seen in person. We always feel that it's better to be safe than sorry. Just go ahead and make that switch. Don't mess up your bill and your income and your revenue that's coming in.
Just be very careful because we always know if Medicare does something, the normal insurance payers do stuff. And if you're in managed care programs, plans with other payers, then you be on the lookout. Be on the lookout. What
And
else
it's
does this mean?
I do want to say this really quick. If you can't see a new client in person, for instance, your practice is strictly virtual, we just think it's best that you reschedule the session until that shutdown has ended. We have a better understanding of what that rule is going to look like because they may postpone it again. We just have to really wait and see.
You can shoot for it. That person that first visit might deny it. Then your follow-up visits will pay. That initial new patient, they might not pay. We doubt that they're going to put it in effect that quickly. Just know that effective February 1st, that rule did expire. The rules that actually expired with that flexibility is your geographic restrictions. They come back. Medicare may not reimburse telehealth for patients in rural areas. May only geographic restrictions come back. Medicare may only reimburse telehealth for patients in rural areas, not for everywhere. What's another one?
No more home based telehealth coverage. That's what you just said. So
Yeah.
no more home-based telehealth coverage for many services once it expires. Oh, Jesus, today. Sorry, y'all. Patients might need to be in a facility again. Certain providers like PT, OT, SLP, they may no longer be able to bill telehealth under traditional Medicare if
Mhm.
the flexibilities do expire. What does all this mean?
What you're used to billing over telehealth may not be covered. Just basically, especially therapists. So whether you're touching, talking, or behavioral health is one of the ones that they're letting slide right now. Everything else is like when I say behavioral health, I do not mean medication management. I mean counseling only. Medication management, you guys do need to see your patients. at least twice a year, especially the first visit. That's where we at.
Providers are, y'all are really in a race against the calendar. Of course, that's the type of chaos that really grinds our gears. We advocate for both the providers and patients. That's our motto. We're big on that. Just trying to keep y'all in the loop.
There is a bill in the House right now that it will extend the flexibilities until 2026, even make it permanent. They're AMA, HFMA, like a whole bunch of organizations. They are lobbying. There are bills on the floor. So don't be too sporadic about it. There are bills on the floor. Again, healthcare is not the number one priority up on the hill right now. Just make sure that you're staying with it. Call your state legislators to help have them push this for you guys, because your voice does matter. It still needs Senate approval and a signature. The deal is not done yet. Just know that the bill is on the floor. It's out there at the House. It's out there. They're lobbying for it. All the healthcare organizations are lobbying for it right now. Like I said, we're on the back burner. We ain't even on the burner. We're on the warmer. We're not even on the back burner. We on the warmer. Just putting that out there. They might backdate some of these rules. Just know there is something on the floor right now. It's at the bottom of the stack. It's at the bottom of the stat. So keep your fingers crossed. Call your state legislation. Tell them how much it means to you, what it's going to do to their community, the people that voted for them to be in the place that they are right now, that how it's going to affect the people that voted for them. Have them push it. Have them push it out so we can have these telehealth restrictions not lifted and made permanent.
Definitely. What do you all need to do during this time as a practice? So make sure you're double checking your telehealth claims now, confirming coverage with payers so that whether it be your Medicare Advantage, commercial insurers, like Satasha said earlier, they often follow Medicare policies. Just be aware that may be a thing. I feel terrible for, especially like for practices that are strictly virtual, because this will affect you all tremendously. If you've been following us, this is something we've been talking about since we started Messy Mondays. I'm just trying to get you all prepared, in case you needed to rent a space or a room or whatever the case may be.
You need to tell your patients. You do need to notify your patients, especially the patients who do not have modes of transportation, your elder care, and the ones with disabilities. You especially need to make arrangements for them to either find a provider near them that they can get to, or to make it so that they can get transportation to and from where you are for these said visits. Medicare does pay for transportation sometimes. Some insurances do pay for transportation sometimes. Medicaid sometimes does, but depending on what type of plan that they have. Those are things that they need to look into, and they need to talk to their social worker or their appointee to try to get this additional information. Like we said, we are provider advocates and we're patient advocates. Don't have those patients come in there, then the claims get denied and pushed to self-pay because you didn't want to follow the rules, or you didn't want to take heed to the rules, because that's not fair for the patient, especially if you didn't give them a heads up of what's going on. You also have to remember surprise billing. You also have to take that into consideration. If you know that this is going to affect, or you're not following the guidelines, if this is being pushed out to you guys, you bill the patient, you could be liable and get in trouble. Let's not risk our practice or our licenses because we don't want to follow the guidelines under the guise that they're going to make it official or permanent later on down the line. We still need to follow what's going on right now, because we don't want to cause any audits. We don't want to do anything to lose our patient or our reputation within the community of whatever specialty that you're in. One thing we always talk about: documentation. Now is going to be a matter of a lot. It's going to matter a lot. Documentation is going to matter a lot, because you could see retroactive denials for the services being overturned, because later on down the line, you're going to have to prove it. You're going to have to prove it. Make sure that your documentation is not as locked and tight. Because if House goes in, Senate goes approve it, let's say in March, all your claims from January until now could be reprocessed and paid appropriately to invoke the telehealth rules again. Did I miss anything?
We're going to end this by saying telehealth was a lifeline for practices and patients during COVID. We get that. We know that. We understand that. It's been extended again and again as of January 31st, 2026. Those relaxed rules could fall away if Congress doesn't act.
In a nutshell, do we have clarity? No. Are we confused too? Absolutely. We're just trying to keep you guys in the loop and make sure that you guys understand what's going on. As soon as we hear something different, we will definitely keep you guys updated. Now, please know, we ain't for it. We don't like it either. We don't like it because it makes our jobs a little bit harder because now we got to go in here and pop your hand and tell you that you're doing something wrong or you got new patients coming in and you're still doing telehealth. We just need to be cautious. Your front desk needs to know that too. Make sure you're passing this information to everybody that's within your practice if it's not just you. Don't you be messy. Let us be messy on Mondays. Don't you be messy. Do what you're supposed to do.
That is our Messy Monday Medicare update. We'll see you all next week for more chaos cleaned up with real talk.
We will attack some more tough truths. Remember, it's all about improving, learning, and becoming a better provider. Learning what's best for you and your practice. If you found this episode helpful, which you should, go ahead and share it with your colleagues, your friends, and other people in your community. Join us next Monday for more insightful stuff to help your practice game tighten up. Or keep it cute, keep it ethical, and take care of your patients. Bye. Bye.